What is up, Sleep Tribe? Welcome to a brand new episode of the Healthy Sleep Revolution podcast. I am your host, Meghna Dasani. Today, I have a dear friend. I want to say I've known her for, 10 years maybe, or longer, who knows. And that is Dr. Sirisha Bhandaru. She is a soul sister, if I may use that term. The only thing that separates us is location. I like to say she practices in the Dallas Fort Worth area and has a practice very similar to mine with a functional focus on total body health as well as sleep apnea treatments for her patients. So let's welcome Dr. Sirisha, or Dr. B, as she is lovingly known by with her team, her patients. So welcome to the show.
Hi, Meghna. Thank you so much for having me today. It's an honor to be on your podcast.
Oh my gosh, I know we've talked about doing this for months and then
I
something comes
know.
up. Yes, life happens. So let's dive into this. I know you have a general practice. What got you started on the pathway to functional health dentistry as well as sleep dentistry? What sparked
Oh
your
my
interest?
God. You know the story. I'm going to share it for everyone's benefit. So, my father-in-law, my husband's father passed away in, I'm thinking 2008, 2009. In one of the best hospitals in the world in an intensive cardiac care unit the day after he had that defibrillator placed. He was this skinny man, very tiny, slender person, has been known for snoring his entire life. And if he would go to like a party or like a get together or a family gathering, he would wait for everyone to fall asleep before he would sleep. And it was 2008. I was at Penn, and we got a call from a mother-in-law that he's in the hospital, and they told us her to let us know that he's not going to make it. So we go. Long story short, he passes within hours after the surgery because his brain did not wake him up when he was getting out of anesthesia. And oh my God, I still get goosebumps every time. I've told the story like thousands of times. I still get goosebumps. And then we didn't know anything about sleep apnea at that point in time. It was not something. This was like years and years, more than a decade ago. And then as life was going on, my husband snored now and again. And then we had kid number one, and kid number two comes around. We both gained a good chunk of weight. And I could not sleep in the room with like two kids that are needing us and a husband who was snoring all night. So I got him tested for sleep apnea. I think I heard your podcast or your something. It was you who got me started, okay? And then I took him to my favorite sleep MD in town, Dr. Shaw, and then he tested him, got him started on CPAP. And like most of us know, it's not very user friendly for brand new parents. And that didn't work for us. And I came to your class actually in Houston. I think my baby was 6 months at the time. I put them in a hotel I attended, and you sent me home with the watch pad unit. And you remember it came back and he was like 84.
I remember that.
And then you were like, let everybody go. You're going to sit down and you're not going to leave, and we're going to sit down and talk. And you're like, where's your husband? And I'm like, he's at my friend's place. He's like, call him. We need to have the conversation today. And this was 9 years ago. And thanks to you. And oh my God, we've just had a couple of patients today, and they were like, I've never slept like this. So that's like the long version of a very long story.
But they're all personal, and I don't think that that connection ever goes away. And I love the fact that you just shared that your patients said that they've never gotten this kind of sleep before. Isn't it amazing how normal it becomes to feel tired, right? Because that's our normal. We've never known what getting consistent nights of good quality sleep looks like. I know you have this conversation with almost all your patients in the practice. Now, do you see kids as well as adults, or just walk us through what this looks like in your practice?
Okay, so for answering the first part of the question, yes, we do screen almost all adults. I would say almost is if some people like completely refuse it or they're already on CPAP therapy, we don't go back and screen them. But everybody gets a CT scan in our practice when they walk through the door. I know it's not diagnostic,
Correct.
but it gives us indication on if they have like enlarged turbinates or if the airway is like so small, like we'd say, is it like a coffee stirrer or a boba straw? Which one do you have back there? And we go through that and we evaluate patients' tongue ties, even as adults. We go through them. It's like an everyday conversation in our practice. If we
Mhm.
are talking to a parent and we know they have children, we automatically talk about, hey, you know what, go home and check your kid out and see if they're checking any of these boxes. And our new patient questionnaire, the intake questionnaire, has the stop bang and Epworth, which are both nationally accepted standards for screening sleep apnea. We check every single person and any size, like clenching, grinding, bruxing, your crowns are breaking, your fillings are breaking, anything. We encourage them to get tested for sleep apnea.
What are the
Couple
signs and symptoms that you're noticing in your patients that is encouraging you to push them to like, hey, go see the sleep MD or go get a sleep study? What is it that you're screening for? Just so our listeners, and of course, I know we had this conversation. Our show is geared towards the everyday person.
Of course,
Of course, we have other doctors, log in as well and listen in. But what is it that what are the signs and symptoms that you see as a dentist that goes, I wonder what's going on here?
The first biggest thing is when you're laid back and you're with your mouth open and I'm working and you're not able to breathe. You are choking for air. There's water in your mouth. You hate the dental appointments. And my patients are like, I love you so much as a person. I go out to have a drink with you, but I hate sitting in your chair because I cannot breathe. That's the
Yes.
biggest thing. And the second biggest thing I've noticed is when patients say nothing, everything we put in their mouth or the previous dentist, whoever, the crowns are breaking, like I said, fillings are breaking, and they've had this beautiful smile makeover, and the veneers are popping left and right. So that's one of the biggest things.
So
And
it's not poor dentistry, right? It's not that somebody else did
no,
a bad job. It's something
no.
going on with them.
Yes, and for kids, the biggest thing I've noticed, correct me if or agree or choose to disagree with me, is when the kids are in sports, especially like soccer in Texas, soccer is huge, soccer and football, everybody plays it, is when they're running, they're having a belly ache or throwing up because they're not able to get any air through their nose.
Correct, correct. Not enough oxygen. But then
Hmm.
also, like you mentioned earlier, we look for the clenching and grinding, right? We look for the
Hmm.
scalloping of the tongue. We look for patients that have been given a night guard before and said, oh my gosh, I can't sleep with it. Talk to me about those patients.
Oh God, it's funny you should bring it up. We had this conversation, I think like yesterday, almost every single day. The patients are like, I don't like night guards. I can't wear them. And then we get to the path of getting them tested for sleep apnea and we get them fit with the appliance and they look at it, they're like, oh my God, it's so big. I don't think I'm going to wear it. I'm like, just try it on. When we do a 2 week follow up, they're like, I can't believe I love it so much. I can't believe. They're like, I love it so much more than the skinny little guard that we have. And if it is in the scope, at some point, I want us to touch upon like the soft night guards that patients.
Yeah, absolutely. This is your stage.
Okay, so
Share your thoughts.
okay, the soft night guards. I'm not a huge fan of it. We have this conversation every single. It's like every single day. It's like sleeping with a jelly bean in your mouth. It's working for you because it's keeping the joint away because you're just a little bit open, and B, you're still able to clench because you have that gift,
Right.
and that causes so many problems with TMJ, bite shifting, teeth breaking, and oh my God. So if at any point in time you have a night guard and you don't like it and you like the store-bought one because it's soft,
That's a red
I
flag right there.
oh God, it's like a red flag, like all over the place. You really absolutely have to get tested for sleep.
Yes, no, I love it. I'm the same. I tell patients it's like sleeping with gum between your teeth. You almost want to chew because it's there. That should
Mm-hmm.
tell you, that should be your clue. So yes, I completely agree. What is a screening, what does a regular exam in your office look like for adults? And we'll touch upon kiddos as well. But when you're looking in their mouth, yes, we're looking for clenching, grinding. You said evaluating for the night guard. What else is it that you're looking for? Oh, can't tolerate the water.
Can't tolerate the water. We check for tongue ties.
Oh, yes,
Tick,
that's a big one. Let's touch
yes.
upon that.
Two kinds, right? Like grade, like anterior and posterior. Anterior is when your tongue's not able to leave your mouth. That's what everybody knows about. Posterior tongue tie is when the tongue is not lifting. So when you're swallowing, you're using all your muscles or you're swallowing with your mouth open. That's one of the biggest indicator that a person has a tongue tie, has a sleep apnea or restricted airway or sleep disordered breathing, whatever we want to call it,
Yeah.
is if the tongue is so tight and tethered to the floor of the mouth, what's going to happen when you're swallowing? You can't. When you're sleeping, what's going to happen? The tongue's going to fall back because natural position of the tongue, accepted natural position is it should be touching the roof of your mouth. It should be like a shoe and a foot. They're like right next to each other. If it is not doing that, then it's going to fall back and choke you when you're sleeping.
Correct.
So that's another thing. That's one of the biggest things we check for, and we do the measurement with the ruler where you put it behind the front teeth and see how restricted the person is. Another thing we see is how wide your mouth is. I know that for a lot of patients, what I've noticed is that the teeth are straight and they fit the jaw. Most people are happy with it. But do you have a V or do you have a U?
Yes.
That's more important too. Once we'd gotten through all these, that's when we say, you know what, let's test you, let's not test you, or guide them whichever is required by the people there.
What is the biggest roadblock or what is the biggest struggle you have when you're having these conversations with patients? Is there one objection that keeps coming up, or do you find that patients are receptive to this information when you're sharing it with them? I know when I started screening for sleep, about 15 years ago, people were like, why are you talking about this? Like, tell me if I have a cavity or not. Are you facing any roadblocks there, or how are your patients taking it?
I'm thinking with more knowledge that we have nowadays, most people are aware of the term sleep apnea, not like when you started, like being a pioneer in the field for us. But it all comes down to why hasn't my doctor mentioned it, or why I haven't been told before? Is my insurance going to pay for it? That's like the biggest roadblock for patients. And for
You
that
have
reason,
solutions for that, right?
yes, yes, yes. We do pre-authorize for patients who want to use their insurance benefits. We do HSA payments, FSA, and we do offer third-party financing for patients who do not have any of those facilities available for them or don't qualify for any of those. We just had a patient who did not have sleep apnea, but they had upper airway resistance syndrome. This is for the small people, narrow necks, narrow noses, not textbook sleep apnea, but they have all the symptoms of it. So especially for situations like that or primary snoring with no significant apnea episodes, we do offer patients a third-party finance.
That's amazing. And I know you have really, really great relationships with MDs, sleep MDs, specialists that you work with. Has it been easy? Has connection with those doctors been an easy workflow, or what challenges have you faced with that?
Starting out like 10 years ago, there was not a lot of awareness in the MD circuit or a general population circuit as how a dentist would be able to treat a medical condition. But over the years, like I've mentioned, more and more MDs are accepting of the fact that the appliance or the device that we custom make for all of our patients is more accepted, efficacy versus effectiveness, right? Like they use it every night and it doesn't interrupt with their everyday life. So they are getting to the point. I've just had a chance to speak to this amazing ENT group. They were very excited about it. The tide's turning. How about that?
I
Easy way to put
love
it.
that. I love that. And especially for a practice like yours, I kind of want to take a little bit of time to talk about how you look into total body wellness for your patient. And yes, we're not practicing medicine, but I know you have a more holistic approach to this. And sleep apnea is one part of that equation for your patients and how you're screening them. Would you mind walking us through what are the things that you look at and what dots you connect for your patients? Say I were a new patient in your practice. what are the things you're going to be screening for and connecting for my health?
We do, in addition to like regular fillings, crowns, and all that stuff. This I'm not even going to touch base on that because that's expected in a dental appointment.
Right.
We do, like you mentioned, the scallop tongue. We check for the groove in the middle of the tongue, which may indicate a deficiency like zinc or magnesium. We do talk about vitamin D supplementation for patients, especially for everyone, of course, but especially postmenopausal women
Mhm.
for bone density and bone mass. And we talk about magnesium glycinate versus any other sleep aid that would naturally help them get their circadian rhythm back in. I know I'm going back to the sleep, but
Oh, I
um,
know. It's our passion. I mean, it's fine. We could talk about this today.
get back in that. But we've had a couple of, couple no, like a handful of patients last month that we had to do biopsies on because they had this thicker plaques or keratosis, hyperkeratosis of their gum. And I would say almost all of them were pre-diabetic.
That's interesting.
So it's so many symptoms show up in the mouth first before they show up in the rest of the body because our mucous membrane is so thin. And especially like if the gums are bleeding, like we were talking about PeriProtect the other day, that's another aid for patients who are other people are living longer lives with age comes decreased dexterity, decreased manual force, and more other health issues that you're dealing with, especially cancers and dementia. So we're trying to incorporate a lot more to help our patients
Mhm.
have a more healthier life in general, because we all know that there's been recent studies that show link from increased oral bacteria and Alzheimer's disease.
Correct. Not just the inflammation, but especially if you tie in the sleep apnea aspect of
Hmm.
it,
Hmm.
it doesn't get cleared away. While we're on the topic of gum disease, I know that you have a laser to help your patients with advanced periodontal disease. Is that correct?
Yes. Oh my God. I love that laser.
All
You
right.
know, like
Tell
I
us
can't
about
stop
that.
talking about it. It is Indiac laser that is for the nerds who want to look up or interested people who want to like deep dive into what kind of laser it is. It's called Perulase. The procedure is the LENAP. It is like getting gum surgery without a scalpel. It's like LASIK for your gums, for lack of a better word.
I love that. LASIK for your gums.
Yes, that's what I tell my patients. They're like, how are you going to do it? And I'm like, there's no need. It's just laser. So we go in there. This laser is so amazing. I was like mind blown when I first read about it. Is it doesn't have to touch the gum to separate the gum. There is no touching the gum at all. There's no cutting. And then we go in there and do the nice cleaning. And the laser is so potent that it goes and finds it is attracted to the pigment that's in your bacteria and just
Mhm.
zaps it. And then we go back in there and oh my God, it is a night and day. It's like life changing. I think the first patient I had done was like just before COVID. It's almost like 6 years ago, surprisingly.
Yeah. Yeah, I know.
We have not had to remove a single tooth on that person.
That's amazing. That's a huge win because now not only are you saving their teeth, that is also the laser that has been shown to grow bone, correct?
Yes, that is 100% correct. And we use it it has this property of creating more denser bone. So when we place the implants, once everything, surgical site is ready, we spin the laser in the prepared site and on the implant body before putting in there. So you have great success.
That's amazing. That is amazing. And do you think that happens because you're getting better quality bone or because you're getting rid of bacteria?
I'm thinking it's to both
Both.
because it all depends on how well the extraction socket has healed.
Mhm.
Sometimes the body doesn't lay bone like we would like it. It doesn't go in like layers. There's like defects and everything, and maybe there is some infection lying around because implants fail for that major reason. It's infection.
This is
So,
fascinating. I could sit here and talk to you about this all day. So what
oh
I'm
God.
hearing from so what I'm hearing from you is you're looking at your patient's health holistically with the big goal of reducing the inflammatory load on their body. We're looking at not just addressing sleep apnea and the oxygen deficit that it brings, but you're also decreasing bacterial load when you go in and make sure periodontally that they're stable and that the bacteria balance is more of the healthy versus the unhealthy, right?
And yes, I'm not trying to plug in my practice, but one more thing I really, really love doing for like our health of our patients, and especially if you're putting crowns or fillings, is we do ozone. That is another thing that is so beautiful. Is since we start, I think I learned it at your practice too when we trained
Correct.
together
We offer it too. Yep.
with Dr. I can't think of. Anyways, when is we've had, I would say minimal, if at all, no sensitivity once we started incorporating that into our everyday practice for any restorative need, like fillings, crowns, everybody. And it is like magic.
That's amazing. Amazing. I love it. As we start to wrap up, would you share how can our listeners find you, find your practice? Would you share your website, your Instagram handle? Where can they find you and connect with you?
Yes, we are located in Carrollton. My practice is called Carrollton Smile. It is a suburb of Dallas, so we are very easily accessible. We are on 121, so it's not hard to find us. And our practice website is carrollton-smiles.com. That's our main practice website. And we have a separate website for our sleep apnea patients, so they're not getting lost in all the dental terminology. It is sleepapneadentistdallas.com. I know it's a
Sleep
word.
Apnea Dentist Dallas.com.
Dallas.com. Or if you want to like find us very easier, much easier, just you could search us as Sleepwell DFW
Sleep
and
Well DFW.
DFW.
For all of our listeners, we will have Dr. B's contact information, her practice website, her bio, read up on her. She's highly, highly trained. Social media handles, all of that fun stuff in the show notes. So no need to scramble to get to writing all of this down. We will have all that good information for you in her show notes. As we wrap up today's episode, what are your top 3 tips for our listeners that may be wondering anything about their sleep, about their health, their dental health? What are your top 3 tips?
Okay, first thing, well, since it's a Sleep Revolution podcast, I am going to start with the sleep. If anybody at any point of time you have morning headaches or tense jaw or backache or you're not waking up refreshed, talk to your doctor, talk to your dentist, get tested. It's just easy. It's just one thing you have to do, and that's going to save your life. And I know one more thing. This is what I tell all my patients is the older we get, we are like an old car. We need more work done, more tune-ups versus
Or
a young car,
TLC.
more TLC versus when we were younger, like a brand new car. So if when in doubt, get tested. For dental health, apart from sleep apnea, keep up with your appointments. It's easier, cheaper to get your work done when it's small versus waiting much longer, much less painful when you do it earlier on. And third most thing, keep up with your appointments with your physician. Keep up with your appointments with your primary care doctors. Get your blood work done on time because prevention is so much cheaper for a great quality of life than having to treat something that you don't have
Yes,
to.
absolutely. And I will cheat here and add one more because I cannot seem to stop telling people about this. Snoring is not normal.
Exactly. Especially in babies or children. It is not normal. It
Yes.
is so easy to take care of in children.
Yes. Yes. Perfect. Well, thank you so much for taking time today to come chat with us. It finally happened, and I'm so thrilled it did. Thank you for everything that you do for your community. And to our listeners, like I said, all of Dr. B's information will be in our show notes. Go check out her website if you are a local in the DFW area and you send me messages asking if I know a doctor there. She's your girl. Please do go check stuff out. And I will talk to you guys next time.